our next session on the agenda, after I give a big thank you to this whole panel. Thanks, everybody. Our next session on the agenda is an interactive poster session featuring short presentations, and then we're going to have the opportunity to connect with speakers in different breakout rooms. The theme of this poster session is interventions in public health and climate emergencies. So it's a really great follow-up after this presentation. So for the next few minutes, we're going to have the chance to hear short 2-minute pitches from 3 different presenters. And that will be followed by 15 minutes of breakout rooms where you can take the time to talk with each of these speakers and connect directly with one another. We will have instructions for how to go into the rooms afterward. So just bear with me there and we'll get you sorted in the room that you're meant to be in. So to start us off, I'd like to welcome Jill Maloney. She's an advisor of disaster risk reduction, climate change adaptation. And she'll be presenting on being proactive in a reactive system, blending psychological and emergency preparedness in the climate emergency with lessons learned from the field. So welcome, Jillian, and I will share my screen to have your slide up there.
Thank you so much. Great, so thank you so much for the warm introduction. Very happy to be here, joining today from the East Coast, the ancestral and unceded territory of the Mi'kmaq, and also home to the Inuit of Nunatsiavut and the Inuit of Nunatsiavut. And in saying that, I'd like to highlight, and I'm sure it's no surprise to any of you, that the people who've contributed the least to the climate emergency are facing the most impacts. For the purposes of my presentation today, I'm focusing on Indigenous people and on youth. And in terms of my background, working as part of an interdisciplinary framework that includes health, mental health professionals, educators, emergency managers, and community partners, my role is to help support families and individuals in times of crisis, primarily related to climate and other disasters. I've supported emergency response from Victoria, BC to St. John's, Newfoundland and Labrador, and that's included things like the Alberta wildfires in 2016, Atmospheric River in BC, where I came out to Abbotsford for a couple of weeks, Nova Scotia wildfires, Hurricane Fiona. And what we're seeing, again, no surprise to any of you, is that the intensity, the frequency, and the duration of these events is increasing at a substantial rate. I joke, but it's not a joke. I've been in response since the first day of the Fort McMurray wildfires. There has been a response somewhere in this country related to a climate disaster recovery relief operation since then. And of course, overlaying all of that is the anxiety, the anticipatory grief, living through COVID. So it's been a ride. The last thing I'll mention is, as part of my MSW practicum, I worked with the mental health and psychosocial support team with the Red Cross, and that's where this research has come from. So very much focusing on truth and reconciliation, Indigenous sovereignty, and relational accountability. So bringing that social work lens, the emergency management lens, then bringing that over to disaster risk reduction. So to close, and I hope I'll get to speak with some of you shortly, I believe that equitable action towards climate change will enhance our capacity as a society to meet, experience, and recover from climate emergencies. So thank you very much.
Great, thanks very much, Jillian. And next we have Stephen Cremando, Director of Training, Disaster and Terrorism Branch, New Jersey, Department of Human Services, Division of Mental Health and Addiction Services. And Stephen will be speaking on developing a climate-informed disaster behavioral health response system. Welcome, Stephen.
Well, thank you very much. It's great to be here. Jody mentioned the purple shirts. We are calling from New Jersey, and we are the blue shirts, or the blue team. I acknowledge that the land I'm standing on is the ancestral home of the Lenape people, and I pay my respect to the Indigenous people throughout the Lenape diaspora, past, present, and future, and honors those who have been historically and systemically disenfranchised. New Jersey is a very high-risk place in the U.S. for a wide range of different sorts of weather disasters. And when I began my work in this field, which was in 1988, the US averaged $1 billion or more disaster about every 82 days. And today we average one every 13 days. What we have found going forward, based on just the frequency, the intensity, as you know, that pretty much every mental health professional that we work with increasingly needs to become aware of climate and of the disaster response. And every disaster responder, or specifically disaster mental health responders that are part of our teams, the blue shirts that we're speaking about, and you see in the cover slide here, several who are on the call with us today, that all of our disaster behavioral health responders increasingly need to be climate aware and climate informed. So what we have done with our team, which is 12 paid members and more than 500 credentialed disaster mental health volunteer responders in New Jersey, is start a program about 3 years ago to incrementally create what we're referring to as a climate-informed disaster behavioral health response system. And what I was going to discuss in our breakout session is really what that has involved, how that has been going, and really the importance of it as we're moving forward in our team's development to something we believe has been unique here in the States, at least, which is this climate-informed model to disaster behavioral health. So that's where we are, and I hope several of you join us for the discussion in the breakout group.
Hi, thanks very much, Stephen. I think it'll be a really great discussion. So yeah, thanks for being here all the way from New Jersey. Next up, we have Leah Douglas. Leah is presenting on the social work role and sphere of influence in mental health and climate change. Welcome. Ooh, where did you go?
Thank you.
Ah.
Everyone can hear me okay? Good. This has been such a great morning, so we are so appreciative to be here. My name is Leah Douglas. I am a social worker. We're going to be talking about social work issues and concerns. Today, we want to give a bit of an update about what is happening both in the field and from an academic standpoint. We are going to be talking about the sphere of influence, the role of social work in terms of mental health and climate change. We right now have some limited research around the best way for social workers to respond. So we're really looking at how we can increase our impact around people. We have existing relationships with people who have existing vulnerabilities. We're going to talk about a book that we are working on. And whether you come to our session or not, we would like to put it out there right now. We're seeking experts who have a background around mental health and climate change. So even if you are not able to attend our session, we hope that you can connect with us at some point if you think that you have some expertise that you could contribute to an online press book. We're going to look at how social workers can use trauma-informed and anti-oppressive perspectives from both a clinical and mental and social justice perspective around this area. And I'm joined by my co-researcher, Miranda Rosehill, who is a Master of Social Work student.
Hello. Hi, I'm Miranda. I am a student researcher that was hired by Leah to support her sabbatical research, and I'm also completing my master's at the University of the Fraser Valley. Yeah, thank you for having me.
Great. Thanks, everybody. It's really exciting to hear about all this research and all the initiatives taking place. I'll now stop the recording